First, some important points from the definition of heart failure. So, the basic points are that it's not just a single disease, it's actually a syndrome, and there can be functional or structural defect in heart. And next, but very important point is that the cardiac output may be low, but it can be normal at higher filling pressure, and the symptoms are also present. So that's actually the basic points from the definition of heart failure. So if the condition is that the cardiac output is not sufficient to meet the metabolic demands of the body, so that it's heart failure. Again, when the cardiac output is sufficient but the filling pressures are high, then again it's heart failure. And if the conditions in which the metabolic demands are very high and the cardiac output is not sufficient to meet them, like in case of hyperthyroidism and chronic anemia, then again it's heart failure. It can be abrupt or it can occur gradually. Abrupt in a case in which in case of MI, in which a large portion of the wall is involved, then it can be abrupt. And in case of gradual, like there is progressive loss of myocardium, so then heart failure can be gradual. There are two types. One is the systolic and other is the diastolic. So as the name indicates, in case of systolic, there is actually dysfunction in the systole. And what's actually happening in systole, there is contraction of myocardium. So the inadequate myocardial contractile function occurs in systolic heart failure, and it can happen in case of ischemic heart disease or hypertension. Now, diastolic heart failure. In diastole, the major function of the heart is that it relaxes and it fills blood. So if there is diastolic dysfunction, then there will be inability of the heart to relax and fill properly. And it can occur in case of left ventricular hypertrophy, myocardial fibrosis, amyloidosis, constrictive pericarditis as well. So it occurs mostly in the older adults, diabetic patients and women. Now let's deal with the mechanism here. First, we will increase end diastolic volume. What is end diastolic volume? It's the volume of blood that is present in the heart at the end of diastole. Okay, so if there is increased end diastolic volume, then there will be increased end diastolic pressure, obviously. So now see here in this diagram, if there is, in case of suppose right heart failure, there is increased end diastolic volume, and as a result there is increased end diastolic pressure here in the right ventricle. So as a result there will be increased backup pressure, so the atrial pressure will also rise, and as a result there will be back pressure in this venous system, so there will be backward failure. Similarly, in case of left ventricular failure, left heart failure, there will be increased end diastolic volume, increase end diastolic pressure in the left ventricle, backup pressure, increase left atrial pressure, and then in the pulmonary veins also increased pressure occurs. So we will have backward failure, and there will be congestion in the venous system. Okay, and forward failure occur because the heart is not able to contract properly, or it is not able to empty properly, so the cardiac output, it actually decreases. So that is, the decrease in cardiac output is known as forward failure. Now there, well, compensations occur. One is Frank Starling. Increase in diastolic volume is going to cause dilation of the heart. When the heart dilates, there will be increased stretching, and as the heart muscles are going to stretch more, they are going to cause forcible contraction, so in order to maintain the cardiac output. But with time, this compensated heart failure is going to be converted into decompensated heart failure. When the heart is going to be dilated, there will be increased wall tension and increased requirement for oxygen, and this will become one of the causes for decompensated heart failure. Next is the activation of the neurohumoral systems, like the activation of the sympathetic nervous system. It's going to increase heart rate, resistance in arteries, arterioles, and contraction of the venous system. That is going to increase the venous return and increase contractility. Next is the activation of renin, angiotensin, aldosterone system, and it's going to cause the arteriolar increase in arteriolar constriction. As a result, there will be increased peripheral resistance, and there will be absorption of water and sodium. Next, we will have another hormone here, that is atrial natriuretic peptide, and this is going to balance the rest activation. It actually causes the diuresis and vascular smooth muscle relaxation. Now the compensated heart failure is going to be converted with time into decompensated heart failure, and as I have told earlier that the oxygen requirement is going to increase because the cell mass it actually increases because of the hypertrophy, and as a result of increased cell mass, but the capillary bed doesn't expand, so there will be more chances of ischemic injury. And with time, because of the activation of this compensation neurohumoral system activation, there will be altered gene expression that will be going to cause changes in myocyte function. Like the right, it's normal that heart rate is going to increase, force of contraction is increasing, but the oxygen demand is also increasing as well. So there will be with time there will be changes like myocyte apoptosis, increase in ECM deposition, and cytoskeletal alteration as well. Important points regarding the myocardial structural changes. First, if there is pressure overload, then the new sarcomeres that are added in this direction. So the myocyte is actually going to thicken. Okay, and as a result of this thickness, there will be diastolic compliance that is going to decrease. Decrease diastolic compliance because of thickening of this myocytes, and the cavity is going to decrease in size. And next, if there is volume overload, then the new sarcomeres are added in this direction and the muscle will increase in length. And as a result of increase in length, there will be systolic dysfunction. The muscle will not be able to contract properly and actually lead to dilation of heart. So that's all about heart failure. This is just an overview. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.